In the area are continuing to test patients for COVID-19, but resources are limited even as testing ramps up. Kayla Green now live in Rochester, and she talked with a doctor from Rochester Regional Health today. Kayla, can anyone get tested here?
Maureen, no, not everyone can get tested. That's why the biggest thing doctors want you to know is to contact your primary care provider before you do anything else. If you don't have a primary care provider, you can call 922-CARE, which will connect you directly with a nurse who can help you figure out what to do next. Calling ahead will help you discuss those symptoms with your doctor, and they'll help you determine if you should be tested for COVID-19. Doctors say if you have symptoms of COVID-19, you should call your primary care office. Dr. Bridget Weifling says symptoms can include fever, cough, and shortness of breath.
Because of resources and testing availability, we're not able to test everybody that would like to be tested for COVID. We really need to have the providers, both the primary care providers and our urgent care and emergency room teams, make decisions about who are the patients most likely to have COVID and benefit from testing.
If you are directed to get tested, Rochester Regional has 5 testing sites with a 6th on the way. Those include UMMC Urgent Care, Webster, Greece, and Henrietta Immediate Cares, and a drive-up site, Wilson Urgent Care.
Patients who are referred to Wilson would be driving up in their car. They're being triaged in their car. They stay in their car and they go in for, they're registered, and then they're seen by a provider, and determinations about what kind of treatment they need.
Dr. Weifling says if you have any symptoms, you should self-isolate immediately.
If you are self-isolating, staying in your room, and it means you're not going to Starbucks for a latte, okay? It means that you really need to stay put in your room, in your home, to limit the exposure to your friends, your family, and anyone else in the community.
The test itself is a quick nasal swab, and results come in between 2 and 5 days. Now, Rochester General Hospital is currently processing 100 tests per day, and they have processed over 200 total at this point. University of Rochester Medical Center has also announced today they are beginning to process tests, and they will have more information on how that will work with them by the end of this week. Live in Rochester, Kayla Green, News 8.
All right, all good information. Thank you, Kayla.